Early detection and prevention saves lives. Good evening, dear viewers. Welcome to yet another episode of BMC Global Live AL-HILAL Health World. Nothing but lifestyle. Myself, Marina Francis. Today, on the 54th episode of AL-HILAL Health World, we have a special topic which is very much relevant for this month. The topic today is breast cancer awareness. Yes, definitely we know October month is dedicated for breast cancer awareness particularly. So we have a very apt person, very apt doctor joining with us today to detail us about breast cancer awareness this month. So let me welcome Dr. Rajani Ramachandran, gynecologist with over 10 years experience. She is currently working at AL-HILAL Hospital, Salmabad branch. Let us move ahead to today's discussion. Good evening, doctor.
Hello.
Welcome to yet another episode of Health World.
Thank you.
Thank you for joining with us again.
Yeah.
Doctor, firstly, in the introduction I said October month is dedicated for breast cancer awareness. We are seeing posters all around, seminars all around. So let me ask, why October?
Well, a genuine question, like all would wonder why October of all the months, you know. So, well, this basically dates back to the year 1985. It was in that year in the United States, a campaign, an organized movement started, and this was done because they wanted people to be more aware about the dangers of the breast cancer and breast disease. So it started way back in 1985, and after that, people took to it like every year, and campaigns and programs have followed through several years to this date. And so we are here in another October this year to educate people to know the dangers of the this global health issue.
So then, doctor, what is the aim of actually observing the month of October for breast cancer awareness?
Well, October month, we have this aim to educate people, women especially, all over the world, to be aware of their own body so that they know the symptoms and signs of breast cancer, because prevention is better than cure. So the idea behind October month is it aims at early detection and prevention of breast cancer. So a lot of societies, medical societies, government agencies work together with survivors to raise fund for the research of breast cancer and also educate people for early detection and prevention of the disease.
Doctor, so when you came in today, I noticed that pink ribbon on your coat, and even the pink ribbon is there in our poster. So why this pink all around this month?
Yeah, this pink is basically to remember all those whom we lost to the disease, to honor the survivors, and also to help those who are working against this deadly disease, help through the research and the progress we are making to defeat the disease basically. And this pink ribbon that you asked me about is, it dates back to the year 1992, when Alexandra Penny was editor-in-chief of the Self magazine. And she came up with a magazine issue of second annual magazine. It was pertaining to the breast cancer annual screening program, and she wanted this issue to be over the top. And so she got a lot of cosmetic societies to promote this, and it went a real success in all the New York City stores. And that's how this she created pink ribbon thing. That's how it came into being.
So doctor, let us move on to the main topic. What is breast cancer?
Well, breast cancer is basically uncontrolled growth of cells in the breast. That's why it's called breast cancer, because cancer basically means something that grows without any control. So it can affect different parts of the breast depending upon which kind of cell in the breast tissue is affected.
Doctor, so what are the causes of breast cancer?
Well, we cannot pinpoint one particular cause, because the cause or the etiology of the disease is still not fully understood. But then if you ask me, one cause, being female is itself a risk factor. Men do get breast cancer, but it's very rare. Okay. And the next one is age. With increasing age, the chances of breast cancer are much more. So if you see 8 out of 10 cases of breast cancer, a woman will be mostly over the age of 50. So it affects usually women over the age of 50. So increasing age is an independent risk factor for breast cancer. Also, family history of breast cancer. It has been seen that if the first degree relatives, if your sister, your mother, or second degree relatives suffer from breast cancer, then the chances of one suffering from breast cancer increases. All the more if in the family there are some people having ovarian cancers, the chances increase. So a family history of breast cancer independently increases your risk factor for a cancer. Also, it has been seen, if you've had a personal history, like a past history of breast cancer yourself, or you are like exposed to, like you have had a lump before at a particular age, and the biopsy report shows that it is showing cells that are little atypical, which are not particularly malignant, cancerous, but they have a tendency to change into cancerous growth. Such people are also susceptible to getting breast cancers later on in life. And also it has been seen that women with dense fibrous tissue in the breast also have an increased tendency to get breast cancer. These are some things that we cannot change, like increasing age, being a female, also your family history, your personal history. But there are some things that you can probably change in, and those causes are like, one is obesity. Obesity increases the risk of breast cancer because of the estrogen increase because of the adipose tissue, and also use of exogenous hormones, like some women take lot of steroids, like they don't get their periods on time, so immediately they start taking exogenous hormones like estrogen, contraceptive pills for more than an year or two without even asking the doctor. So exogenous hormones, taking it from outside, can increase your risk of breast cancer. Also, alcohol consumption. Daily drinking of alcohol has shown an increase in breast cancer. Also, it has been seen that some people have like certain kind of, they feel that they have a cough or something, so they go for repeated chest x-rays or CT scans, or they have some issues like, like Hodgkin's lymphoma. They go through a lot of radiotherapy, and which involves the chest area. In such people also, exposure to radiation increases the risk for breast cancer. So when a patient does come to us with lump, we go through a detailed history, like note the age, their weight, their habits, and many things go into categorization of their risk to getting a cancer.
Doctor, all types of cancers are in today's world, it is very much concerning, but let me ask, how common is breast cancer? We hear it very often.
Well, in some countries it's the most common cancer, but largely worldwide it's second most common cancer in the world. And the incidence is like, relative risk, like 1 in 8 women will suffer from this disease. Like suppose you ask a person, you would find someone in your friends or relatives or co-worker, someone will be suffering from this disease. You will know at least one. So that common the disease is now.
Yes. So that definitely increases the importance of such an awareness throughout this month.
Yeah, we need to educate them about knowing, because it's such a killer, that people think that you need some kind of a lump to find this disease. It's not so. In 3/4 of the people who suffer from cancer, there's no lump, there's no pain, there's nothing, and there's not even a family history.
Welcome back. You're watching BMC Global Live AL-HILAL Health World, nothing but lifestyle. Today our topic for discussion with Dr. Rajani Ramachandran is breast cancer awareness. We only heard about a brief introduction for the topic. We will move ahead with further queries. Doctor, so let me ask you one of the most important questions. What are the warning signs this disease shows, the symptoms shown by the patient?
Yeah, most of the people get worried when they see a lump. When they feel a lump, they immediately come to a doctor and they're very worried. So one that I would say is like most patients come to us with a symptom that is very common is a lump in the breast. Okay, it could be even in the underarm. Okay, another thing is pain. People get really worried, apprehensive about the pain in the breast, bilateral breast. Then following that, there could be like changes in the breast skin, like a redness, flakiness, itchiness. There can be a little thickening of the skin, which is not normal for them. Okay, so that brings them to the doctor. Then what I've noticed is the nipple discharge. Usually in a non-lactating woman, there's no nipple discharge. But these patients, some of them have some yellowish discharge from the nipple. Some people have white, some people have a red, brownish, and this brings them to the doctor. Okay, and also for some people there will be no lumps in the breast, but only in the underarm there could be lump and pain in the underarm, in the axillary region. For some people, they wouldn't be able to feel anything, but then some discomfort when they are moving or something that is absolutely abnormal for them. So we just look into the patient's signs and symptoms really carefully, because that is something that she is not comfortable with. So anything I would say would be a warning sign which is not normal for her, because no two breasts are normal for in an individual and in two people. So what is normal is only normal for her, and that she knows only by examining herself every time and knowing her body herself by doing breast self-examination. So that is why we keep telling that the importance of screening methods, so that they are aware of their own body to know normal from abnormal. Okay.
Doctor, definitely from that let me pick up a question that came up in our helpline number. When should we suspect something wrong, or when should we approach the doctor, is one of the query.
Yeah, like I told you, any pain in the breast, any lump that you have never felt before, or you already had a lump. The doctor has told you you have a lump, and she also knows that there is a lump, but it's different. It's growing bigger, or it's painful suddenly, or the skin over the lump is changing, or there is a nipple discharge, or some discomfort that is not normal to her otherwise. That should not be kept at home. She should get clinically examined by a physician.
So doctor, when a person comes complaining of such symptoms, how do you proceed with the tests that are carried out or the examination?
Yeah, there are several tests. Okay, now when a patient comes, there are screening tests, there are diagnostic tests, there are monitoring tests. So now you're asking about some patient who already has a symptom, right?
Yes.
So she's come with a lump or pain. What do we do? First, generally, as I told you, history taking is very important. We ask them, like, we know the age of the patient, we look at the patient, measure their BMI, the weight and the height will tell if she has a normal range of weight. We note the age, the BMI, and then we get to the family history.
Okay.
Any cancer history in the family, her sister has, mother has, aunt has. Did she have a lump in which the biopsy says there is something abnormal? Okay. Does she have a family past history of a cancer for which she was treated, and this is a fresh lump after that? So these are the history that we take, and also after that is done, we ask about the drug history. Is she on some contraceptive pill? There are women who abuse drugs like anything. They do not go to a doctor, they do not want children, so they keep having contraceptive pill for like 10 years. It's a risk factor for use of hormones for more than 1 year, puts you at a risk of breast cancer. So then you have to go on, some people have polycystic ovarian syndrome. So they are on drugs for, those first few years they go to the doctor. Then afterwards they do not want to. And they keep knowing, they know what medicine is given by the gynecologist. They keep taking it for getting their periods. So you have to get into the history, like is she on any drugs that she's taking over a long period of time? Then any disease, chronic disorder, does she have any cancers, does she having any asthma, does she have any problem for which she is getting recurrent radiation to the chest like CT, X-ray, does she have any chronic other disorder like Hodgkin's lymphoma, she is under radiation, radiotherapy for something. We have to take a detailed history. Once we have done with it, we get down to examining the patient, we examine the breast clinically, and then we assess, because all the breast lumps cannot be felt, a few millimeters cannot be felt by the clinician. So what we do a detailed examination of the breast. We examine the breast, the axillary region, the upper chest, the nodes everywhere below the clavicle, and then we tell the patient like, okay, everything looks good, and we send her for a ultrasound or mammography depending upon her age and her findings. That's how it goes. So this is the first line thing that we do.
So doctor, you mentioned not just of those who have symptoms. Other than that, what are some examinations that can be done for normally for women?
Yeah, so that is about screening. So these are diagnostic tests. Diagnostic tests are for those who come with a complaint, and then we try to assess and we send them for diagnosis. Now what you're talking about is screening protocol. So screening is done in a population who do not have symptoms. So you're trying to detect a disease before it has really caused a symptom. So that is called a screening approach, in which there's something called the breast self-examination. So this had been advocated, very heavily advocated in the past many years, but in the present American Cancer Society guideline, this has been removed from the current guideline. This is, I will explain why. The thing is, breast per se is a very lumpy organ, like fatty organ, and so when this breast self-examination was like advocated for several years, and it was told that any woman over the age of 20 is supposed to examine her breast herself every month. Okay. So what happens when you examine your breast every month? You find some lump, you run to the doctor, you're crying, you have some lump, you're very apprehensive, then you don't get to the correct way, you end up having a lot of biopsies which are unwanted and unwarranted. So what happens? Too much of apprehension, too much of anxiety in the woman, and unnecessary tests. So that came into a lot of randomized control trials went into this to find out, like, are these really useful? So the American Cancer Society lately has come up with this guideline that it is not useful because it is not changing the, it's not helpful in any way, and it is causing a lot of apprehension to the patient. So what we came up with is like mammography, the higher end technology, but we still believe, we gynecologists and surgeons and clinicians still tell patients, please examine your breast, not every month, at least know your body, because it is you who will know like what is normal from abnormal for you. And so we always say like, look for any lumps, any changes in the skin, any aches, don't sit over it. So that is only done if you know, if not every month, at least know your body well. So we cannot really do away with it according to the current guideline, but at least don't get anxious about it and get the next line of modality in line, you know. If you have a lump now, okay, then go to the next line is clinical breast examination done by the doctor. So earlier, whatever said and done, the breast self-examination basically is said to be done by the age of 20, and it's done every month. You're supposed to do it in two positions. One is the standing position, the lying down position, and you stand in front of the mirror. There are two phases to it. First you look and then you feel. So the looking is, you have to bear the chest till the abdomen and stand in front of the mirror facing it, raise your arms, and then just by the side, your hands lying just, you know, relax by your sides, and examine, look at the breast, like do you see anything wrong, anything grossly visible, and then slowly the next thing is feeling. It can be done in the standing and the lying down position. People who do not know can go to the doctor and find out how it is done basically. So in that way, these are the basic things that we do in this one. 3 fingers are done. You're supposed to use not the tip. You cannot poke the breast like that and hurt yourself. Use the this part of the fingers, and it is in a in a circular manner. You have to go in concentric circles in the breast, and you have to palpate the underarms, the region here, just not the breast. So it is like, if you do not know, you can go to a doctor or a health worker and ask them how it is done, and so that you're aware. But do not have to get very apprehensive about anything that you find. All the lumps or pain are not cancers. Okay, there can be benign conditions, and the benign conditions that we usually face are fibroadenoma or fibroadenosis, that is fibrocystic disease of the breast, and they present more commonly than cancers. So for everything you don't have to be apprehensive, run to the doctor telling, oh my god, I have a cancer. Just have to relax. Once you detect something, don't sit over it, take a opinion of a doctor, and then do whatever this. So the next would be, now suppose I found a lump, okay, and I go to the doctor. The doctor examines and finds that, yeah, I am right about having a lump. What next is the doctor going to advocate? Well, depends upon what kind of category. We basically categorize the patient into average risk or high risk. Okay. So average risk will depend upon, like, you have no family history, you're a young lady, and absolutely no problem with your history, you're not on any hormones, you have not had any radiation. So that kind of patients are like, called average risk. High risk is like, you're an old lady, plus you have first degree relatives with cancer, you have ovarian cancer in the family. In such cases, you have taken a lot of hormones. Doesn't mean that you have done all this, you still have to get cancer. Okay, so you just have to, risk categorization is done, and accordingly if the woman is like say 45 and above, we would advocate mammogram. But if you are in the younger age group, we would send you for ultrasound probably, because there is no radiation in that, and some lumps are better found by ultrasound than X-ray. Mammogram is basically X-ray of the breast. Okay, and it is not good if the breast tissue is very dense, like I told you. You can miss a lot of lesions. So sometimes we have to, it is the clinician who decides like what do you have to go for. Mammogram is the best screening technique, but then the age is one thing, and does the patient really, do we have to subject the patient to any kind of radiation is next question. So that totally depends upon the doctor. And the next in line after X-ray is the mammogram is MRI of the breast. But that's kind of a costlier investigation, and it is used to monitor or investigate patients who are at high risk category. Like I told you, there are some genes which are like implicated for the breast cancer, that is BRCA1 mutation and BRCA2 mutation. So in these kind of women, they are very susceptible to cancer. So you cannot keep doing mammogram for their follow up, right? So in that kind of cases, MRI has no radiation. So that is why we follow up these patients and screen these patients with MRI. So different techniques are used for different people according to the lesion, what they present with, what the history is, and what the doctor finds, basically.
Okay. So doctor, after such diagnosis, after evaluation, how long does the treatment take, or generally how does it go? How is the treatment taken?
Well, see, the earlier it is detected, the less radical the surgery is going to be. It can be a lumpectomy, it can be a lobectomy, like a segment of the breast. So the earlier detection will see that the breast conservation is more possible. That is why all these awareness programs are made, so that we can detect the disease earlier on, because the more advanced the cancer, like any cancer, the more advanced the cancer, the more difficult it is to treat the disease. So there is no particular time range, will depend upon what stage the cancer is in, stage 1, 2 or 3 or 4, depending upon the staging of each of the cancers. But basically it is a treatable condition if it is detected earlier on.
Okay. Doctor, once treated and once the patient is fine, are there still chances to again get breast cancer?
Definitely, because these cancer cells sometimes metastasize, they just move to other places. Okay. So they can through lymph node, through blood. So all the patients, not only breast cancer, any kind of cancer, the patient is on constant follow up. They are called back. X-rays are done, we investigate, we do their blood counts, we keep monitoring them. Only when the doctor says, okay, you are like free from it, will that stop. But this thing is very important. This follow up of cancer is very important, because it can just come back any time. There can be bone metastasis, you will never know. Unless you have a fracture, you go take an X-ray, mets everywhere. So these are like, you think you have survived it, but it comes back, because it doesn't stay, if it is like localized to one part and it has not spread, it is like kind of taking away the organ, might be a cure. But most of the time, if it has gone and progressed, and you have to be on constant follow-ups.
Doctor, in one of the courses you said if some relative have had ovarian cancer, that is one of the risks. How is it actually related?
Well, I told you there are a few genes implicated. So this, if one of the genes are like, you do your chromosomal study. Okay, suppose you have a high risk of ovarian cancers, breast cancers running in the family, and your mother, your aunt, everyone is having this BRCA gene mutation, then immediately what happens is you are at a very high risk of getting. Okay. So in that case, the treatment will be very, what to say, some people even have oophorectomy, like ovaries are removed very fast so that they don't get cancers, because definitely they have a 60 to 40%, like breast cancer might be 40%, 60% chances that they will have an ovarian cancer. In that case, you will have to, act quickly. Prophylactically, it is removed even before the cancer occurs.
So, doctor, you spoke about mammogram as one of the tests. How is mammogram conducted? How frequently?
Well, mammogram is the best screening technique for modality for breast cancer detection.
Okay.
It's basically X-ray of the breast. There are different kinds of, mammography. Like normal mammography is like an X-ray picture of the breast. Then there is like digital mammography. It's a computer-generated picture of the mammogram, and also there is tomosynthesis. These are all like mammography. So this is usually because there is a risk of radiation. You cannot keep putting a patient to risk of radiation every year. So this has been like, I told you, like the risk of breast cancer is more as your age goes up over 50. So earlier again the current recommendation has done away with 40 years. Earlier the previous guideline, American Cancer Society had told like, from 40 to 45 years of age you can do annual you start the screening at 40 years of age. Now they're done away with it. 40 to 45 years of age, if you want to do an annual screening, you can do it. But it is usually started at from 45 years of age. So annual screening till 55 and then 2 yearly. That's how it goes now, the mammography. It's done for everyone, like it can just attack anyone. It just is there. So it may not have symptoms at all. Okay, you need not have a family history, you do not have a lump, you don't have to have a pain. That is why the whole population is screened. This is for an average risk. A higher risk person, I told you, you cannot go with mammography earlier on in age, keep following up. So MRI breast is used for that to help mammography. Yeah.
So every year mammogram can be done as part of
it has to be done. It has to be done. Earlier it was 40 years of age, now it's like gone up to 45. Seeing that the average age of occurrence is around 50 to around 70, they brought it, lifted it up. So now the recommendation quotes like after 45. From 45 you can get screened, but if you want to screen from the age of 40 to 45, you can do it.
Doctor, most importantly, how to prevent? We are talking about early detection is better, prevention is better, but what exactly should our viewers be taking home today after this talk?
Yeah, well, that's what we were all talking about, the October being, the breast cancer awareness month, and whole thing is to, prevent a situation than getting it. So finally, first thing would be know your risk. So go to your doctor, talk to your family, like who has cancer, doesn't have cancer, talk to your doctor, find your belong to the average risk population or the high risk population. Okay, first thing. Second thing is know yourself. Okay, so for that you must examine your breast, if not monthly, at least know your body, what is normal for you and not normal for you, to know what is normal from abnormal. Third thing would be go through all the screening protocols that has been advocated, like if you're over the age of 45, go for annual mammograms, and after 55, 2 yearly. And if you find anything is wrong, please don't sit over it, go to a doctor. And finally, there are some things like you cannot change your age, you cannot help getting, every second we are getting old, we cannot, it's moving forward, so you cannot change time, being female, or your dense breasts or anything, and your family, first degree relatives who have cancer, but you can change some things, that is like your lifestyle. So work on your diet, exercise at least 5 times a week for 45 minutes, do your cardio, strength training, and also try to limit alcohol, kind of substance abuse, and also spend some time doing something you like so that the stress is relieved, because at the end of the day I see all that for something that I say cancer is still not very fully understood. I think coping up with stress gives solution to many problems, even if you have cancer or you're going into it or you do not have.
Thank you very much, doctor. Those were really very valid points that we need to keep reminding our audience. Thank you very much for joining with us today. Definitely, this episode was a very relevant one. All of us need this reminder that is not just in this month of October, throughout the year. We need to keep this in mind. Reiterating what I said, prevention, early detection is definitely better than trying to cure after the disease has come. This is Marina Francis signing off. Until we meet again, good night.